My name is Jennifer Lemack, and I'm the Chief Curator of History here at the New York State Museum. I'd like to welcome you all. Our speaker today is Robert Snyder, the Manhattan Borough Historian and Professor Emeritus of American Studies and Journalism at Rutgers University. He has devoted his career to writing, teaching, and lecturing about the history of New York City. He has written for both scholars and the general public in books such as Crossing Broadway, Washington Heights, and The Promise of New York, All Nations Under Heaven, Immigrants, Migrants, and the Making of New York. And now the book he's going to talk about this afternoon, When the City Stopped, Stories from New York's Essential Workers. To share history with the broad public, he has worked with the Smithsonian Institution, National Public Radio, and the Museum of the City of New York. He is a podcast interviewer for the New Books Network and the Gotham Center for New York City History at the City University of New York, and has published essays in the New York Times, the Washington Post, and The Conversation. He is a Fulbright lecturer in American Studies in Korea and is a member of the New York Academy of History. He is also a huge friend to New York State history in general. Our speaker, Rob Snyder.
Thank you, Jennifer, and I'm honored to be described as a great friend of New York State history. And thank you all for coming out here today. There's a story behind every story, and that includes my new book on the COVID-19 pandemic in New York City. When the City Stopped, Stories from New York's Essential Workers is embedded in the tremendous work of historians, archivists, and folklorists who recognize the importance of the pandemic and work to record its history in New York City. The book is also the product of the memories, stories, and poetry related by people who suffered, coped, and worked during the COVID-19 pandemic. It's also, and I realized this only after I finished the book, embedded in my own life and work. My work in oral history started with a course that I took with Al Howard at Livingston College of Rutgers University in 1974, and it continued in a course I took with Ron Greeley in graduate school in 1981. I've worked with oral history ever since as a professor of journalism and American studies and as a historian and journalist with a special interest in New York City and a commitment to sharing history with a broad public. Working on this book taught me many, many things, among them that the reading and learning I did in college are still useful to me almost 50 years after my graduation, and that the work of archivists and folklorists and librarians is vitally important if we're going to collect the sources and raw materials that we need, if we're going to understand the relationship between our past and our present in decades to come. When COVID-19 struck New York City early in 2020, I was a newly appointed Manhattan Borough Historian. For all that I knew about Manhattan and New York City, I knew nothing about viruses, COVID-19, the history of medicine, or public health. As borough historian, it's my policy to help people when I'm knowledgeable. And when I'm not, I try to get them to a better source. So when journalists started calling with questions about COVID, I recruited historians who were knowledgeable about the histories of medicine and public health to answer these queries. David Rosner at Columbia, Janet Golden, who just retired from Rutgers Camden. Janet and David's willingness to share their knowledge inspired me to invite a wider group of historians, folklorists, archivists, and oral historians to gather over Zoom. Our gatherings were completely improvised, but they were guided by the idea that our responses to the pandemic would be better if we worked together and shared ideas and questions. In our conversations over the spring of 2020, we tried to make sense of a rapidly unfolding crisis in public health, and as historians, we tried to put these events in a historical context. The obvious precedent was the flu epidemic of 1918, a global event that took some 30,000 lives in New York City, 675,000 lives in the United States, and more than 50 million worldwide. We were amazed that this global disaster had all but vanished from public memory. Historians wrote about it, but the children and grandchildren of people who endured it, people of my generation, barely had any knowledge of it. I'm an example. I learned about the 1918 flu epidemic only in college when I interviewed my grandmother for an oral history project. She casually mentioned it. That set off a chain of questions. I learned that it was a terrible event and that my grandfather was not shipped to Europe in World War I with the rest of his army outfit because he was so sick with the flu that hospital personnel on the base where he was stationed assumed that he would die of flu. He didn't die. He went on to become a transit worker, and that's one of the reasons I'm here today. And it's one of the reasons I'm also interested in transit workers. There are memorials to the soldiers of World War I all over New York City, but there's no memorial to the people who died in the flu epidemic of 1918. And there's no memorial to the doctors and nurses who bravely cared for them. That lack of public memory of the flu epidemic left New Yorkers less prepared to face the COVID-19 pandemic. Many of us thought in 2020 that if we did our work properly, people would remember the pandemic in useful ways. I'll say more about that later. As historians will do, we searched for analogies that would help us clarify our thoughts. Was the pandemic comparable to the great epidemics of the 19th century, like cholera, to tuberculosis, to AIDS? Josh Brown of the American Social History Project hit the mark when he said the pandemic would be as big and significant as the Great Depression of the 1930s. Convinced that we faced a unique crisis of extraordinary importance, we got to work. Historians set up oral history projects all around the city. At Fordham University, students pivoted from interviewing for the Bronx African American Oral History Project to interviewing all kinds of Bronx residents all over the hard-hit borough. They worked over Zoom and conducted some of the earliest interviews about the pandemic in the entire city. The Columbia Center for Oral History Research built on the long presence of oral history at that university and earlier work done after the terrorist attacks of September 11th, 2001. They compiled a large array of interviews, notably with nurses, doctors, and healthcare professionals. At the College of Staten Island, students recorded interviews with people all around what sometimes gets called the Forgotten Borough. Queens Memory Project, already documenting the individual stories of life in Queens, turned to recording Queens' lives in the pandemic. Archivists at Brooklyn College started a local branch of a global project, Journal of the Plague Year, to collect online the writings, images, art, and media productions that expressed Brooklyn responses to the pandemic. At City Law, folklorists collected poems, writings, and photographs. And at Pace High School on the Lower East Side of Manhattan, David Rolfing's English students put together a lexicon of the pandemic, a dictionary of words and phrases inspired by the COVID-19 experience. We learned that people were coping with terrible feelings of isolation. People were scared. Some New Yorkers, when they went out to work, weighed terrible risks. They needed to work to support their families, but if they caught the virus on the job and brought it home, they feared infecting their loved ones. People compared the pandemic to other disasters, most commonly 9/11. And in those comparisons, many thought that COVID was worse than 9/11 because it killed more people and it lasted longer. People were angry and thought New York was abandoned by the Trump administration. People hoped for some kind of better future after we passed through the pandemic. They hoped to live in a city whole and healed. As we accumulated recordings, photographs, and more, we confronted a big question. What will we do with all this stuff? For a while, we contemplated creating a big digital repository online. Something like this had been done after September 11th, 2001, but it was too big a job and too expensive a job. We settled for organizing archival homes for the material we collected in our home institutions. You can now find great materials online through Columbia University, Brooklyn College, Fordham University, the Queens Memory Project, and the College of Staten Island. It's not all under one roof, but it's available for future generations to study and explore. But where did that leave me? I didn't want to become a web designer, and I didn't want to become a fundraiser to pay for anyone else's website. But long before the pandemic, in my daydreams, I'd thought that if I had lived in the Great Depression, I might have found myself a place in the Federal Writers Project. The Federal Writers Project was one of several efforts made under Franklin Roosevelt's New Deal to simultaneously promote the New Deal's good works and knit people together, spotlight the sources of American strength, and help people meet the crisis of the Great Depression. They did inspiring work, oral histories of enslaved people from the Old South, along with city, state, and regional guides. The Writers' Project left a record of the Great Depression for future generations, and it launched great careers for writers and photographers. And its democratic spirit, looking at the lives of ordinary people and recording history from the bottom up, inspired people like the great oral historian Studs Terkel, whose work I first encountered in a college oral history course in his book Hard Times, an oral history of the Great Depression. I'd also encountered in my college years a book by a great French historian, Marc Bloch, called Strange Defeat. As a historian, Bloch was famous for his writings on medieval history and how he helped found the Annales School among French historians that stressed studying long periods of social history and in dialogue with regions and environmental history. Bloch had also been a soldier in the French army in 1940, and he experienced firsthand Nazi Germany's defeat of France. Bloch did not take defeat easily, so even though he was in his 50s, he became an active member of the French resistance. He also wrote a book, Strange Defeat, to explain how France was victorious in World War I, but quickly defeated in World War II. He traced his country's collapse to political divisions between left and right and hoped for a future where French people were devoted to France as both a republic and a nation. Inspired by both the Federal Writers Project and Marc Bloch's Strange Defeat, I set out to write a book that would help future generations understand the ordeal of the pandemic and how we got through it in the words of the people who lived it. There was no single common experience of the pandemic in New York City. We all experienced it in many different ways. As one of my grad school mentors, Tom Bender, observed, if New York City is ever to form some kind of collective response to COVID, people will have to gain a better understanding of what other New Yorkers endured. They would have to enlarge their stock of empathy and apply it to understanding people who survived COVID in very different ways. I would not write a total history of the pandemic because it was too soon to do that, and it was too soon to accurately engage the impact of COVID on our city and our country. I also, frankly, didn't know enough about medicine or public health to do a good job on a book like that. But I do know a lot about oral history and how to tell a good interview from a poor one, and we had lots of good oral history interviews to work with. With the help of two interns, Gracia Brown and Brendan Reynolds, I dug into more than 400 interviews, poems, journals, and first-person narratives. What experiences could we uncover? What concerns could we see? There were holes in the coverage, and I filled them with my own interviews with transit workers, first responders, and activists. After months of reading, I noticed recurring themes in the interviews: coping, which everybody did, suffering, which everybody did, and working, which people did in very different ways. Some coped by leaving the city for the relative safety of country houses. Others coped, like me, by isolating themselves in their apartments. But others, essential workers, went out to perform jobs and then scrubbed themselves clean in an effort to expel the virus from their bodies. Suffering varied too. Some people were terribly lonely. Some people were frightened. Others coped with tragic losses, the death of the loved ones, or the death of a patient they tended to in a hospital. Middle-class people with white-collar jobs like me worked from home, using computers and telephones. Working-class people often labored in frontline positions as transit workers, hospital workers, supermarket cashiers, or food delivery workers. They faced infection and death as they went about their daily jobs. I could only reprint a small percentage, maybe 10%, of what we had looked at, but that relatively small selection had to be coherent. The interviews had to hang together in some way. I thought hard and wrote multiple drafts of the book's introduction. To do justice to all the different voices in my book, I muted my own voice so the interviews, poems, and narratives would stand out. Eventually, I found a frame that seemed to work. I would publish select interviews that dealt with coping, suffering, and working. And I would put interviews with essential workers at the center of the book because their labor, at terrible costs, sustained the city over months of hard times. They faced death and sometimes died so that the rest of us might live. Just 5 years after COVID-19 struck New York City, we've almost forgotten the early days of the pandemic in the spring of 2020, when refrigerator trucks were filled with dead bodies and 800 people a day were dying from COVID. We may remember the lockdowns and disputes over masking and vaccines that persist to this day, but we fail to remember what actually kept the city running and helped it survive: the labor of essential workers in our hospitals, grocery stores, transit system, police precincts, and firehouses. The desire to forget the traumas of the pandemic is perfectly human, but forgetting the labor that saved the city would be a dangerous mistake. In a world where the avian flu hovers near us, measles is reemerging, and viruses are mutating daily, we need the example of essential workers' courage and solidarity to strengthen us for the next public health emergency, whatever it is. When Andrew Cuomo's New York on Pause plan took effect on March 22nd, it divided New York State's workforce into essential workers who were expected to go out and do their jobs as first responders, healthcare professionals, transit workers, sanitation workers, food delivery workers, and cashiers in supermarkets and drugstores, and the rest of us who could labor from home. In an age when so much of reality is thought of as virtual, essential workers faced actual hardships in the streets, on subways, in stores, and in hospitals. Their work affirmed a point made by the literary critic Paul Fussell. There are only two classes of people: those who might get hurt or killed on the job and those who won't. The pandemic dramatically expanded the number of jobs that carried a deadly risk, then doubled the inequality by disproportionately claiming the lives of Black and brown New Yorkers. Faced with such dangers, more than 40,000 New Yorkers and more than 1 million Americans died of COVID-19. People who worked under the threat of COVID were sustained by many different beliefs and values. For some essential workers, above all police and firefighters, facing danger is part of the job. And transit workers toil in a system of buses, subways, and repair yards where hazards are common. But others face danger for the first time. Healthcare professionals expect to confront dangerous illnesses, but the communicability of COVID was unusual. Cashiers in supermarkets and drugstores were surprised to find themselves facing a deadly disease transmitted by customers. It was a scary time. Police officers, paramedics, and emergency medical technicians went into the homes of the sick to provide support, care, and when all else failed, transportation to a hospital. Nurses learned new skills overnight to meet the demands of COVID-19, then held cell phones next to their dying patients so they could hear the voices of their loved ones. Doctors improvised new forms of communication and treatment. They reinvented their jobs sometimes to provide better care for their patients. Cashiers and food service workers provided meals and emotional support for customers. For all their bravery, many essential workers faced terrible working conditions. Bicycle couriers who delivered meals for restaurants confronted poor pay, bad weather, and the galling fact that the restaurants they served would not let them use their toilets. Healthcare professionals grappled with shortages of protective gear and medical supplies. Transit workers had to deal with passengers who ignored rules on social distancing. One bus driver was knocked unconscious by a passenger after he asked him to put on a mask to cover his chronic cough. Still, for a brief time, the city seemed united. Every night at 7 p.m., New Yorkers leaned from their windows and stood on the sidewalk to cheer their essential workers. For precious minutes, we broke out of our isolation, saluted the best in us, and strengthened each other. Working together, putting the common good first, the city managed to bend the curve. Stay-at-home orders, social distancing, and masking brought the number of infections down. By June, the COVID-19 surge of spring 2020 was over, and deaths were down to a much reduced level of less than 50 a day. But the spirit of solidarity proved short-lived. Ironically, after vaccines against COVID-19 were introduced in December 2020 and danger eased, the city was gripped by a sour mood, starting with negative reactions to a glitchy computerized system of registration for vaccines. Restaurant owners had to contend with both changing municipal guidelines and customers who flouted masking requirements. Old currents of hatred, especially anti-Semitism and racism against Asians, gained new strength. Over time, the value of the vaccines themselves became a subject of debate and disinformation. One of the great lessons of the pandemic is that solidarity is hard to maintain. When the interest of public health and personal interest were aligned, as they did in the spring of 2020, people were willing to wear masks and engage in social distancing to save themselves. Once the vaccines made them feel safe, they were reluctant to accept limitations on their individual lives. Maintaining public health requires setting aside private interests to serve the public good. When a communicable disease attacks, it becomes clear that the health of each of us is bound up with the health of all of us. In the grim days of the pandemic, essential workers were their brothers and sisters' keepers. For all the divisions in our city and our country over the pandemic and so much else, the courage of essential workers is something we all can admire. We need to learn from it if we are to build a better future. And now, in the spirit of my book, which is to give them the last word, I want to just read from 3 interviews and narratives that are reprinted in the book. The first one comes from Ali Mazanoff, a health science major at Brooklyn College. He and his parents immigrated from Russia and settled in Brooklyn, and he went to work as a paramedic and then an EMT. And he was working and going to school at the same time when the pandemic broke. And he wrote this statement about his initial reactions for a course that he was taking at Brooklyn College. I worked as a New York City paramedic for several years before the COVID-19 pandemic hit the world. As paramedics, we were trained to deal with situations as simple as a cut on the arm, as complex as directing a team to care for a cardiac arrest patient. When COVID-19 hit New York City, I was unaware of how bad it was going to get. At first, we thought it was a virus that was going to be weaker than influenza, which is something we deal with on a regular basis. At this time, we would get 1 call a day that was related to COVID-19. I thought everyone was exaggerating. Over time, COVID-19 patients became more frequent, and in the matter of a month, it was the only type of call we would get. It was as if every other medical problem that people had went away. But this was because everyone that wasn't affected with COVID-19 was too afraid to go to the hospital. When things started to take a turn for the worse, people were starting to go into life-threatening situations on each call. My partner and I would need to resort to extreme measures, like putting a tube down a person's windpipe and into their lungs to help them breathe. Sometimes this wouldn't be enough, and the patient would go into cardiac arrest for lack of oxygen in the body. It was very difficult for me because I felt powerless to stop people from dying from this terrible disease. It got so bad that the hospital did not have the capacity to accept any more patients that came in. People were put in hallways next to nursing stations, and hospitals had to dedicate entire floors to COVID-19 patients. Then another problem started to rear its head. My coworkers and friends started to get sick. Those of us with families had to make a choice, either quit their job to protect their families or live apart from them until this was all over. We did not have enough EMTs and paramedics to staff the ambulances we had running on any given day. Those of us who were not sick picked up anywhere from 60 to 90 hours a week. The struggle continues now as well. All over the world, there are not enough emergency services personnel to cope with the call volume that we're given each day. The next statement I want to read comes from Patricia Chu. She was a nurse at New York Presbyterian Hospital on the east side of Manhattan. There's also another branch in Washington Heights, but she was on the east side. And she worked as a nurse, long, hard shift as a nurse. And when she went home at night, she taped messages on her cell phone. She recorded short videos of advice to her fellow nurses, telling them what she had seen that day and trying to buck them up for what they would face on the job in coming days and weeks. Here's a brief excerpt from what she said in one. This was April 6th of 2020, when COVID was almost at its worst in the city. The last time I spoke, I said New York City was on fire. Well, welcome to hell, because we are basically at the gates of hell. We are very close from the tipping point, reaching the peak. We're almost there, but we haven't reached it yet. I have accepted the fact that our government, our president, and no one is coming to help. So New York, it's just us. No one is coming to help us. And working in this ICU, the number one goal is basically to save as many lives as possible. Everybody's dying, and you're just doing your best to keep every single one of those people alive. Every minute that I have gone into work, you are working at like 150%. You don't even have time to think your own thoughts. You do everything you can to make sure they're breathing. The one thing I really feel is anger, and I'm angry. We are in war. We know New York is in war when we're by ourselves, and I've accepted that, but I'm never going to forget what's happening here. The nurses are being spread so thin, so thin. What they're asking for us to do is beyond God's work. We're going to keep fighting. It's our city, so just keep spreading awareness and stay inside. I stepped out today to do some groceries and errands, and it's amazing to me how many people are still outside, walking around even with no mask, acting like nothing happened. I just don't understand. And we are not at the worst yet. The next 2 weeks are going to be brutal, like brutal. I'm telling you. And no one is coming. No one is coming to help us. So we're all, for my nurses, hang in there, stay strong, have each other's back. Don't be afraid. This is a very scary situation. It's a very anxious situation. Be smart about things, but don't be afraid. If anything, be anger, and let that anger fight, because I'm angry. And I'm really pleased to say for Patricia Chu that she survived the pandemic and is now doing a residency in Texas to complete her studies to become a psychiatric nurse. And she anticipates a long career in public health. And some people have suggested she should think about running for Congress. The last piece I want to read is a poem, because I'd like to finish on something positive. Written by Ron Colm. Ron Colm is a poet, a longtime resident of Long Island City in Queens. He had a 50-year career in bookstores that ended with the pandemic, and he was on unemployment when he went into Manhattan during the pandemic, and that gave him an opportunity to help save a life. I had to travel into Manhattan to cash my unemployment check. So I sat in the front car of the subway, wearing a mask, doing my best to avoid the other passengers. After leaving the bank, I walked back to Union Square Station and found a place on the platform where there weren't too many people standing around waiting. Time goes by and no train appears. There's a sudden movement as a woman, maybe late 50s, tosses her bag and mask onto the tracks, then clumsily climbs down and joins them. "Hey, what's up?" I shout through my mask. She moans and says that this is how she's going to get home. She's tired of everything. She edges over towards the third rail, and unfortunately, because my back is so messed up, I can't physically grab her, so I unleash my best zinger. "Do you believe in any kind of God? Because if you do, you gotta know how pissed off he or she's gonna be if you touch that thing." A young guy comes running over. jumps onto the tracks and lifts the lady up, depositing her on the platform. He holds her waiting for the police, who do show up pretty quickly. My train finally arrives and I go home, amazed at how the universe works. Thank you.